Symbicort is a widely prescribed medication that plays a crucial role in managing respiratory issues. This video will explore what Symbicort is used for, including its effectiveness in treating common respiratory conditions, proper dosing guidelines, potential side effects, and user reviews. Common respiratory issues treated with Symbicort. For individuals grappling with conditions like asthma and chronic obstructive pulmonary disease, COPD, Symbicort provides much-needed relief by combining an inhaled corticosteroid, ICS, and a long-acting beta-2 agonist, LABA, in a single inhaler. By reducing inflammation and relaxing the airways, Symbicort helps to alleviate symptoms such as wheezing, shortness of breath, and coughing. Asthma is a chronic condition characterized by inflammation and narrowing of the airways, leading to breathing difficulties. Symbicort is commonly prescribed to individuals with asthma, as it helps to control and prevent asthma symptoms. It is effective in reducing the frequency and severity of asthma attacks, allowing individuals to lead a more normal life. Another respiratory condition commonly treated with Symbicort is chronic obstructive pulmonary disease, COPD. COPD is a progressive lung disease that includes conditions such as chronic bronchitis and emphysema. Symbicort helps manage symptoms of COPD by reducing inflammation and opening up the airways, allowing individuals to breathe more easily. In addition to asthma and COPD, Symbicort may also be prescribed for other respiratory conditions such as allergic rhinitis and exercise-induced bronchoconstriction. It is important to note that Symbicort is not a rescue inhaler and should not be used to treat sudden symptoms or acute asthma attacks. Instead, it is intended for long-term maintenance and control of respiratory conditions. Understanding the active ingredients in Symbicort. Symbicort contains two active ingredients: Budesonide and Formoterol. Budesonide is an inhaled corticosteroid, ICS, that reduces inflammation in the airways. It works by suppressing the immune response that causes swelling and narrowing of the airways, thereby improving breathing. Formoterol, on the other hand, is a long-acting beta-2 agonist, LABA, that relaxes the muscles in the airways, making it easier to breathe. The combination of budesonide and Formoterol in Symbicort provides a dual-action effect, targeting both the underlying inflammation and the bronchoconstriction associated with respiratory conditions. By addressing these two aspects, Symbicort effectively improves lung function and reduces symptoms in individuals with asthma and COPD. It is important to note that Symbicort should be used regularly as prescribed by a healthcare professional, even when symptoms are not present. Consistent use is necessary to maintain control over respiratory conditions and prevent exacerbations. Dosing guidelines for Symbicort. The dosing of Symbicort may vary depending on the individual's age, severity of the respiratory condition, and the healthcare professional's recommendations. It is crucial to follow the prescribed dosage instructions for optimal results and to minimize the risk of side effects. For adults and adolescents aged 12 years and older with asthma, the recommended starting dose is usually 2 inhalations of Symbicort 80/4.5 mcg or Symbicort 160/4.5 mcg twice daily. However, the dosage may be adjusted based on the individual's response to treatment and the healthcare professional's assessment. The maximum recommended dose is 2 inhalations of Symbicort 160/4.5 mcg twice daily. For individuals with COPD, the recommended starting dose is typically 2 inhalations of Symbicort 160/4.5 mcg twice daily. Again, the dosage may be adjusted based on the individual's response to treatment and the healthcare professional's assessment. The maximum recommended dose is 2 inhalations of Symbicort 160/4.5 mcg twice daily. It is important to use the inhaler correctly to ensure the proper delivery of the medication. Before using Symbicort for the first time, it is essential to prime the inhaler by releasing 2 test sprays into the air, away from the face. This ensures that the inhaler is ready for use. The inhaler should be shaken well before each use, and the mouthpiece should be placed between the lips, forming a tight seal. After inhaling deeply and slowly, the breath should be held for a few seconds before exhaling. It is important not to exhale into the inhaler. Potential side effects of Symbicort. As with any medication, Symbicort may cause potential side effects. It is crucial to be aware of these side effects and to consult a healthcare professional if they persist or worsen over time. The most common side effects of Symbicort include headache, throat irritation, cough, and fungal infections in the mouth and throat, oral candidiasis. Some individuals may experience less common side effects such as tremor, palpitations, muscle cramps, and increased heart rate. These side effects are generally mild and tend to improve with continued use. However, if they become bothersome or severe, it is important to seek medical advice. In rare cases, Symbicort may cause serious side effects such as allergic reactions, including rash, itching, swelling, severe dizziness, and difficulty breathing. If any of these symptoms occur, immediate medical attention should be sought. It is important to note that Symbicort should not be suddenly stopped or the dosage changed without consulting a healthcare professional. Abruptly stopping Symbicort may lead to worsening of symptoms and could potentially trigger an asthma attack or exacerbation of COPD. User reviews and experiences with Symbicort. User reviews and experiences can provide valuable insights into the real-life effectiveness and tolerability of Symbicort. While individual experiences may vary, they can help others make informed decisions about incorporating Symbicort into their respiratory treatment plans. Many users report significant improvement in their respiratory symptoms after using Symbicort. They note a reduction in wheezing, coughing, and shortness of breath, allowing them to engage in daily activities with greater ease. Users appreciate the convenience of a single inhaler that combines two medications, simplifying their treatment regimen. However, some users may experience side effects such as throat irritation or oral candidiasis. These side effects are generally manageable and can be minimized by rinsing the mouth with water after using Symbicort. Users also emphasize the importance of consistent use and following the prescribed dosage to maintain control over their respiratory conditions. Overall, user reviews suggest that Symbicort is an effective and well-tolerated medication for managing respiratory issues. However, it is essential to consult a healthcare professional for personalized advice and to assess the suitability of Symbicort based on individual needs and medical history. Alternatives to Symbicort for respiratory issues. While Symbicort is a commonly prescribed medication for respiratory issues, there are other alternatives available. Some individuals may not respond well to Symbicort or may experience side effects that require a switch to an alternative medication. One alternative to Symbicort is Advair, which also combines an inhaled corticosteroid and a long-acting beta-2 agonist. Advair is effective in managing asthma and COPD symptoms and is available in different dosages to meet individual needs. Another alternative is Dulera, which also contains an inhaled corticosteroid and a long-acting beta-2 agonist. Dulera is approved for the treatment of asthma in individuals aged 12 years and older and has been shown to improve lung function and reduce symptoms. It is important to consult a healthcare professional to determine the most suitable medication for individual respiratory needs. They will consider factors such as the severity of the condition, previous treatment history, and potential drug interactions to make an informed decision. Precautions and contraindications for using Symbicort. While Symbicort is generally safe and well tolerated, there are certain precautions and contraindications to be aware of. Symbicort should not be used by individuals who are allergic to Budesonide, Formoterol, or any of the other ingredients in the medication. It is important to disclose any known allergies to a healthcare professional before starting Symbicort. Individuals with certain medical conditions, such as heart problems, high blood pressure, diabetes, or seizures, should exercise caution when using Symbicort. It is important to discuss these conditions with a healthcare professional, as they may require additional monitoring or adjustments to the treatment plan. Symbicort may interact with other medications, including certain antibiotics, antifungal medications, and HIV protease inhibitors. It is important to inform a healthcare professional about all current medications and medical conditions to ensure the safe and effective use of Symbicort. Frequently asked questions about Symbicort. Can Symbicort be used as a rescue inhaler? No, Symbicort should not be used as a rescue inhaler for sudden symptoms or acute asthma attacks. It is intended for long-term maintenance and control of respiratory conditions. A separate rescue inhaler, such as a short-acting beta-2 agonist, should be used for immediate relief of symptoms. How long does it take for Symbicort to start working? The onset of action for Symbicort varies among individuals. Some users may experience improvement in symptoms within a few days, while others may require several weeks of consistent use to notice a significant difference. It is important to use Symbicort regularly for optimal results. Can Symbicort be used during pregnancy or while breastfeeding? The use of Symbicort during pregnancy or breastfeeding should be discussed with a healthcare professional. They will weigh the potential benefits against the potential risks and determine the most appropriate treatment plan. Can children use Symbicort? Symbicort is approved for use in children aged 6 years and older for the treatment of asthma. However, the dosage and usage guidelines may vary based on the child's age and condition. It is important to follow the healthcare professional's recommendations for pediatric use. Conclusion: Symbicort is a valuable medication for managing common respiratory issues such as asthma and COPD. Its combination of an inhaled corticosteroid and a long-acting beta-2 agonist provides dual-action relief, reducing inflammation and relaxing the airways. Proper dosing guidelines and consistent use are essential to maximize the benefits of Symbicort and minimize the risk of side effects. User reviews and experiences highlight the effectiveness and tolerability of Symbicort, but individual responses may vary. It is important to consult a healthcare professional to determine the most suitable medication and treatment plan based on individual needs and medical history. By understanding the common respiratory issues treated with Symbicort, the active ingredients in the medication, dosing guidelines, potential side effects, and user experiences, individuals can make informed decisions about incorporating Symbicort into their respiratory treatment plans.